Good morning, Daily Dose of Danny followers. Today, brace yourselves. It's going to be all about me. Some of you are saying right now, isn't it always all about you? No, it's not. Usually I'm talking about world events, national events, federal events, local events. Today, it's all about me. Okay, this is like the story of healthcare in America. And I'm just one person. Okay, but let's talk about it. So everyone knows I've been having this pain under my left breast, across my chest, into my back. Pain, pain, pain. A lot of pain, so much pain. And at home, my pain pill I have is Tramadol, which is, it's nothing. It's innocuous. It's not addictive. It's nothing major. So, but I do take that when I have bad arthritis pain. I've been trying to treat the pain. The pain's not good. It's horrible. Every day, I say, I got to go to the hospital. There's something wrong with me. Like, I can feel it. There's something in me. There's something wrong. 4th of July, I'm in agony the whole day. The whole day. It starts at like 2 o'clock in the afternoon, and it just won't go away. I can't lie down. I can't sit up. I'm just writhing in pain. Round about 2:30 in the morning, I decide, because now you're in pain, so you're also angry, because anger is a side effect of pain. I get up, get dressed. I'm in the closet getting dressed, and Boyd wakes up. He comes in. He goes, "What are you doing?" I go, "I'm going to the fucking ER." He goes, "You can drive yourself?" I go, "Yeah." He goes, "No, you're not. I'll take you. I'll drop you off because, no one can go with you." And I was like, okay. I said, "Honey, I just can't do it. I can't live one more fucking second like this." Like, I was close to tears. I was in agony. He drops me off at the ER. There's not a soul there. It's like ghost town. Not a single person in the ER. I walk in, they triage me, whisk me straight to the back, get in a room right away. This is the room that I'm in. You guys need to visualize this, okay? You walk around. I'm following my nurse. It's a male nurse. He's tall. He walks really fast. Around corners, weaving. I lose sight of him twice, but I'm like, he's here somewhere. The room they put me in is the very last room, right next to the emergency exit, across from the bathroom. All of these things are important for later on in the convo. I'm in my room. The nurse comes in. Her name's Mandy. She's amazing. She's just fucking boom, boom, boom. She's like, "I got to put an IV site in. We're not going to start an IV, but, we'll use it for blood draw." I was like, "Carry on. You're not going to find a vein. Just FYI." So she goes and tries and tries and tries. She goes, "I got to get a sonic ultrasound machine. I can't see any fucking veins." Then she comes back and she goes, "Well, you don't have any veins. And the veins you do have are really small, and I don't know what we're going to do, but I'm going to try. This is my job." I don't know where she put it. Maybe right here in my forearm. She finally gets it in. She gets the blood out. 3 vials of blood, sends them away. She doesn't start an IV, but she says it's ready in case we get to the IV part of this thing. I go, okay, great. Now, keep in mind, I'm telling her everything when she gets there. I tell her about the stroke. I tell her about the compression fractures. I tell her about my fear that this was heart related. I tell her all this stuff. So they know my history, right? She knows my history. Go over medication, da-da-da-da. Then another tech comes in and he gives me an EKG. And then he sets me up on the cardiac monitor in the room. And my blood pressure, it puts the blood pressure cuff on. So these are things that have happened already, okay? Then they come in, they do a chest x-ray where they sit the bed up, they put the x-ray thing behind me, sitting there, chest x-ray. All that's happened already. I still haven't seen the doctor. Then the doctor comes in. "Hi, I'm Dr. Laird." "Hi, Danny Stockham." So my normal sitch is that when a doctor comes in or I'm meeting with someone, I try to vibe with them, try to be light and stuff. Like I want them to like me, because it's important for healthcare that the person likes you. If they hate you, who knows what they're going to do. So he says to me, "All right, what are you here for?" And I tell him about the pain and how it's just intense and it's just been going on. I can't get any relief and da-da-da-da. And he says, "Do you have any other health issues?" So I say, kind of in my joking manner, "How long do you have?" And he says, "I'm on for 3 more hours, but you can't take up all my time." I was like, "Okay, you're a dick. You don't vibe with me. That's cool." I go, "Okay." And he goes, let's just hit the high notes." I wanted to go, read my fucking chart then, if you don't want to talk to me. So I was like, okay, stroke, whatever, blah, 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 compression fractures, da, 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 this pain, da, 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 rheumatoid arthritis, blah, blah, blah. I thought I had cardiovascular stuff, but my heart's perfect, strong, amazing, healthy. And I said to him, I'm afraid this is something serious. Like, I feel it's from the inside, like something's wrong. I was like, any fucking chance, I'm thinking in my head, you're gonna fucking touch me and do an exam? I'm in a gown, for fuck's sakes. So he comes over and he presses, is the pain here? I go, yeah, it's there. I go, but kind of here. And then he presses around my back, does it hurt there? And I go, yeah. He goes, okay, that's it, okay? I'm talking like 2 little touches, touch, 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 touch. He goes, all right, let's get a CT and see what we're looking at. I go, CT of the chest? He goes, and this is what he says to me, CT of the abdomen, like, you dumbass. It's not in your chest. I go, okay. He leaves. That's it. I'm done with him. I haven't seen, he came in, he did his thing, which was an asshole thing, and he left. Horrible bedside manner. You're a dick, is my thing. So meanwhile, I'm texting with my sisters, because that's what you do when you're in the hospital, even though it's fucking 3 o'clock in the morning. You know someone's awake. Sid was awake, of course. She doesn't sleep. So we're texting, da, da, da. I was like, he's kind of a dick. And they're like, what's his name? So while I tell them his name, Sid's like, I want his fucking address. Anyway, she Googles him. He has 1 star. He's not a good doctor. So this is the fucker I'm stuck with, okay? All right, so they come in literally 2 seconds later. We're taking you down for CT. Okay, great. Take me down for CT. I'm still in pain, mind you, okay? Still got a lot of pain. But I'm like going from bed to bed. I was like, can I please just do it myself? Stop trying to help me. I'm in pain. You guys don't understand. So I get on the CT bed. They do the CT, whisk me back to my room. And while I'm in the room, I look up on the wall, and it's like every room has, like, you know, a donor's name on it. And it's Dave and Ninichka Ficini, who I know these people. So I thought that was interesting. Took a picture there because, you know, I'm trying to pass my time. So thanks for your donation to Santa Rosa Memorial Hospital. Then I wait. They tell me it's going to be about 30 minutes for CT results. Okay, that's cool. So Mandy comes back in. She's like, we're going to give you a little Zofran through this IV site. And now she starts putting it in. I'm fucking screaming. I'm like, that fucking hurts. Like, what the fuck's there? She's like, there's a lot of scar tissue. And okay. I said, you're not doing that. Take that out. Give me Zofran by mouth. What the fuck? I have Zofran at home. I take it all the time. So she's like, okay. So she leaves knowing that Zofran is the medicine that they need to give me. Now she's done with work. Apparently her shift is over. It's like 5:30, so I don't know what kind of shift she's working. Dr. Laird comes in. This is where it gets super interesting, people. He comes in, he goes, okay, so got the CT results. He goes, first of all, your blood work's clean, the chest x-ray's clean, so there's no worries there. He goes, the CT shows that you're constipated. There's a lot of backed up stool in there. I know this is a gross thing. I said, really? I'm constipated? I said, I don't think so. I go to the bathroom every day. I'm not constipated. He goes, well, that's what the CT shows. He said, so that's causing your pain. I go, oh, okay. So constipation, you feel pain up here and into your back? I didn't know your intestines were up there. He goes, your intestines are everywhere. I go, really? My intestines are on top of my stomach? I said, I've seen a picture of the anatomy before. Doctors don't like to be challenged. He turned and walked out of my room. Fuck you, and the horse you rode in on. So I'm pissed because you're a dick, and I'm pretty sure I'm not fucking constipated. Like, I feel like I would feel bloated and painy. You know what I mean? Like, I know what constipation feels like. Everyone does. I'm not constipated. You just diagnosed all of this agonizing pain as constipation. So I'm like, fuck you. I start pulling off the leads. I'm not going to get, you don't get to look at any more of my vitals. Fuck you. I take the cuff, taking everything off. The IV's been taken out because it was hurting, so I'm ripping everything off. The nurse comes in. She goes, we have some meds for you. I turn and look at her. I go, really? She goes, we have Tramadol and Zofran. I go, I fucking have that at home. Do you think I'm a drug seeker? Do you think I'm here trying to get pain meds? I'm not. Take your pills and shove them. I'm not taking them. She goes, so you're not going to take the medicine? No, I'm not. I rip off my gown. I'm standing there naked in front of her. Fuck you. I don't know you. I don't give a shit. You guys are fucked up. So I start getting dressed, and she goes, what are you doing? I go, I'm leaving. I'm the fuck out of here. And she goes, well, we need to go over your paperwork, like the diagnosis and everything, and you're going to have to sign something. I said, okay. I said, just for a little background, let me give you a little background. I came in this hospital in the ER with a broken fucking neck, arrived by ambulance. You guys sent me home and said I was having a panic attack. The next day, I had a 12-hour surgery for a broken neck. So your little diagnosis of constipation seems like I'm not going to trust that. She goes, you still have to sign the paper that says that that's what Dr. Laird diagnosed you with. I go, give me the fucking paper. I sign my name. I have everything's off. I'm dressed. And she goes, so you're not going to take the pills? I go, no, I'm not. I go, and I'm going out this door. Out the fucking emergency exit. Bye. So I go outside in the cold of the morning. I call my husband. I say, come get me. He goes, you're done? I go, yeah, I'm done. He goes, what's wrong with you? I go, I need to take a shit. Seriously. Are you fucking kidding me? So, needless to say, the rest of we get home. We have to go back to bed. We're fucking tired. By the time I wake up in the morning, I'm in so much pain. I'm like crying from the pain. This is now on the 5th of July, which is Sunday, yesterday. Yeah. Is that right? Oh no, this happened on Friday night or the morning of the 4th. It's the 4th of July. This is our holiday. We're supposed to have like a fun day and, barbecue and, celebrate America. But I can't do anything because I'm in pain. So I called my primary care physician's office to see who's on call. And it happens to be my doctor, Dr. Madeline, who I love and adore. And he's on call. So I'm like, I need to talk to him. So by this time I'm crying. Okay. I'm like hysterical on the phone. And I'm like, and he said that I was full of shit and literally and figuratively, essentially. And, what's wrong with me? And I said, they think it's poop. It's probably cancer. I'm probably loaded up with cancer. And Dr. Madeline's like, Danny, take a breath, honey. Let's take a breath. Let's talk about what's up. So his theory, which he imparted to me while I'm crying, is that I have these 2 compression fractures, T5 and T7. And he gives me the little thing that your spine and all the nerves that come off of your spine all correspond to a place. He said, like, there's a certain nerve in your spine that I could pinch right now and your big toe would hurt. Like, it's that precise. He goes, T6, for those of you who want to know, is your nipple. So it's right across your breast. So T5 above, T7 below into your back. He goes, you probably have compressed the nerves in this fracture. Like, they saw it was a fracture, but maybe it's progressed now and now it's compressing the nerves, like it's gotten worse. Which, of course, I say to him, I exercised. Like 2 days ago, I did a 30-minute workout. And he goes, yeah, you probably need to stop that for right now because we don't know what this is. The other side effect of this kind of compression fracture in this area is that it gives you, like, I think he called it ileitis. Anyways, it's paralysis of the stomach, like your intestines and stuff, like they don't work efficiently. He goes, so you could really be full of shit, Danny. There really could be backed up poo-poo in there. He goes, and you maybe aren't feeling it because it's like a paralysis. It's a side effect of this. So this all makes sense to me, right? Like I know nerve pain and stuff, and this pain is so intense. Like it could be nerve pain, but it seemed, I thought I was having a heart attack. And then I thought, oh my God, it's my gallbladder. Even though the doctor pointed out to me, Mr. I know the anatomy, your gallbladder's on the right side. I go, there's no referred pain. There's no such thing as referred pain. And this is what he said to me, no. I go, what about my pancreas? Same thing, it's on the other side. So neither of those things could be inflamed and causing referred pain. He goes, I just looked at the CT, it's normal. Everything's normal. The only thing it showed was this bunch of poop in there. So all I can do is trust him. He didn't show me the CT, he didn't let me analyze it. So, okay, we're going on with our life, right? Talking to Dr. Madeline, I'm crying. He's like, this is what I need you to do. I need you to treat the pain until I have an appointment with him Monday morning at 8:30. I'm vlogging now, I'm back from my appointment. Treat the pain. What do you have at home? Okay, I have gabapentin, I have tramadol, I have Tylenol. Yes, treat the pain. Till I see you, that's all you need to do. That's your job. So I'm treating the pain. So Saturday night, not good. My daughter gets home from an outing and I'm like on the couch crying. She gets me a heating pad. I take the meds all day yesterday, essentially laying in my room on the chaise in the dark, the heating pad and drugs. I didn't eat. You know what I mean? Like I'm fucked up. But I'm thinking that I'm constipated, so I'm also doing magnesium citrate, taking Metamucil. I'm drinking poop tea, the smooth move from, traditional medicinals. The ER called in 2 prescriptions. I get an alert on my phone, 2 prescriptions. So Boyd says, I'll go pick those up for you, honey. He comes back and he goes, the pharmacist there knows me and he loves me. And he goes, I wonder why they called these in for her. This is so weird. They freaking called in a prescription for Tylenol. Are you fucking kidding me? Tylenol, 500 milligrams Tylenol in a prescription bottle. I fucking have that. Tylenol's in my home. Why would I get a prescription for that? Luckily, copay was $0. That's not the point. That's bullshit. That's like a fuck you to me. Like, because I went off saying you think I'm a drug seeker and I'm not. I'm here for real, actual pain. And I'm just constipated. And then they, generic Miralax. But if all this constipation's up here in my small intestine, you have to empty from the top down. You can't just take an enema, and that's your large intestine. So I'm trying to empty from the top. I mean, I don't want to talk about poop too much, but come on. What the actual fuck? So anyways, I'm all drugged up all day yesterday, pretty much drugged up. Go to bed at like 10:30. So much so that Grace came down at 11 and came back to our bedroom and she's like, what do you old people doing? Why are you in bed? I go, I'm fucking tired. Because I don't go to bed early. She kissed us goodnight. Off she went. I had a great night's sleep. I mean, a great night's sleep with the heating pad and all the meds that I was on. My first good night's sleep in a long ass time. Like the pain didn't wake me up. I woke up this morning at 7 to get ready for my 8:30 appointment. And I said to Boyd, it's like when you're sick in the weekend, like you're vomiting and you got a headache and a sore throat and you feel like shit, but your appointment's Monday. By the time you get to the doctor's, you feel great. It's like I almost felt like that. And I thought to myself, I imagined it all. Everything's imagined. The last 14 days of this pain, I made it up. It didn't really happen because I felt good this morning. But that's rest. We'll do that for you. But the pain's back like it's here right now. But it's not intense like it was, but I'm on drugs, so who knows? I mean, I don't know if I'm on drugs. I don't know the half-life of these medications. I took them yesterday, but who cares? Anyways, I go to see Dr. Madelon. And I think a lot of you are out there and feel the same way. Like your primary care physician, that's your person. I vibe with this guy. I love him. He's just the most generous soul. And so I go in, I'm waiting for him. He comes in and he's like, oh gosh, you look really good. I go, a little bit different than the crying mess that was on the phone on Saturday, right? And he goes, well, I couldn't see you, but you were really upset. He's wearing scrubs, which I've never seen him in scrubs ever. In 10 years of him treating me, I've never seen him in scrubs. He's always wearing a suit. He's like, but why are you so dressed up? Like I'm wearing a little, little shift dress and hair and makeup. I go, because this is how I go out in the world. I present myself for the world. He goes, but you don't feel good. I go, and look good, feel better. It's a concept. They have it for cancer patients. They have people come in and help them with their hair and makeup or scarf and makeup. Because if you look good, you feel better. It's real. It happens. It's a thing. And I live by that. So anyways, he's like, let's talk. And we're talking. And I'm telling him. And this is where I get to the point where I say to him, Dr. Madelon, I trust you implicitly. You're my primary care physician. Like your job is to look at Danny from head to toe and analyze data. I said, so, I get the CT scan of my chest that was ordered by the pulmonologist, and they call me, not the pulmonologist that ordered the scan, another person in his office, and says, we read the scan, your lungs are great. We noticed these 2 compression fractures, you should call someone. So I decide I'm going to go look at the report myself, and I see that it says compression fractures, so I called Dr. Eldon Eichbaum about that, because he's the guy that put me back together. And I also see this thing about cardiovascular changes, about seeing some. So that's how I got Dr. Dar, who's the cardiologist, to look at my heart and do all this stuff. And I said to Dr. Madelon, is that my job? Is that my job as a consumer to read the reports, make analysis, and call the doctors that should be involved in my care? Like, that seems fucking wrong. He's like, no, it's not your job, but we'll take a look at that in a second. I said, can you please tell me what the blood work showed from the ER? Because I need to know my numbers. I have my numbers from June 29th right here on my phone. I need to see these numbers from the ER, exactly the same as June 29th. Now, on June 6th, my numbers were high. amazing. That's why the hematologist released me from care. He's like, you're cured. Like, you're not sick anymore. Your numbers are good. Everything's good. Like hemoglobin, hematocrit, the big markers, they're high. They're in the normal range. Then the end of June, they were low again. Not super low, but low. Like they've dropped 3 points, 6 points. The ER numbers match June 29th numbers. So they haven't dropped any more in the last 5 days. The reason this is important is because 2 days before I had a stroke, I was in complete hair and makeup at a soccer game, cheering, jumping up and down, high-fiving, hugging people, walking around, living my best life. 2 days later, I dropped down from a stroke, and I am septic with pneumonia, and I didn't feel sick. So I'm that person that feels perfectly fine but is totally fucked up on the inside. And I said that to Dr. Madeline, like, come on. These things need to be questioned. Why did they drop so much in 28 days? And how come no one gives a shit about that? And he says to me, he comes and sits next to me, he goes, I just want to hug you right now, but I can't. Is it okay if I put my hand on your arm? Yes, it's okay. This is how we vibe with each other. He goes, let's just forget about the blood work for 1 second. Okay, let's focus on what we know. Let's focus on this pain and, our diagnosis of it. So he's doing an exam. He's like, I read him what Dr. Eichbaum said, because I texted Dr. Eichbaum and said, here's my story. And Dr. Eichbaum said, get an MRI of the thoracic spine ASAP. So I told that to Dr. Madeline. He goes, I concur. That's what we're going to do. We're going to order that. He goes, but let's look at the CT from the hospital. This is where it gets dicey, people. So he goes in his office to look at the CT, and he comes back, and he reads the CT report that's on the computer in the room where we are, because he had already concurred that, yes, I had, poop. He goes, but it says it's in your small intestine, which is kind of unusual. That's a real issue if you're compacted up in the small intestine. Usually it's the large intestine. But he goes, I'm going to look at the CT. So he comes back in my office and he goes, this is not your report. This is somebody else's report. This is a different radiologist. This report's not yours. The report that I just read that coincides with the CT that was actually taken of you says that your stomach and intestines are decompressed, flat, empty, nothing in there. He goes, there's a little bit of stool in the large intestine, but that's normal. People have poop in there. You eat, you have poop. That's what happens. Like, that's normal. He goes, and the reason they did the abdominal CT is they were looking for kidney issues, like maybe you had a kidney stone because you were complaining of so much pain. He goes, but everything's clear. Your CT is essentially perfect. Your abdominal CT shows no abnormalities. It does show the little, plaque issues here and there, but we already knew about those. So he's like, he read the wrong report. Dr. Laird, Mr. ER doctor, who's a fucking dick. He read the wrong report. And I don't know if anyone out there knows Dr. Laird, but I'm going to write a scathing review. I'm going to fuck that guy up. Because when your patient is telling you there's no fucking way that it's constipation and you just say, fuck you, you don't know the anatomy, I'm the doctor, and you walk out, it's a problem. Your bedside manner sucks ass. And I get it's emergency medicine and that, it's treat them and street them. I get all of that. Treat them and street them, but you didn't treat me. You treated me like shit, and you were fucking wrong. So here's my thing. Somebody got a CAT scan and was sent home saying that they're perfect. Their CAT scan was completely normal, and really they're compacted. They potentially have an intestinal blockage that needs to be looked at. But they're home living their best life, and I'm over here fucking drinking magnesium citrate and taking Miralax and drinking poop tea and massaging my guts and trying to go to the bathroom, and there's nothing to go because there's nothing to go. So I say to Dr. Madeline, I want to look at the CT. Take me in your office. I want to see it. I want to see it with my own eyes. Because now I'm a professional. I've been looking at my CTs. I've been reading the reports. So I look at it. I said, okay, so what are we going to do about this? He goes, well, first of all, I want to talk to you because I, of course, went off on how in 2016 I had a chest CT and it showed these cardiovascular changes. And I said to him, and you didn't do anything about it. You never even called me. And he goes, well, that's because your cholesterol numbers didn't concern me. And I said, really? Because I heard I had fucking high cholesterol numbers off the chart. He goes, well, your good cholesterol is 90-something, okay? Bad cholesterol is like 126. So those two numbers combined, somebody do the math, it's fucking high. He goes, but you have less than 4% chance of a cardiovascular event within the next 10 years based on those numbers. Now, the The calcium clog, that's an issue, but it's not affecting your heart. So there's no reason to call you. He goes, and now you're on Lipitor and baby aspirin and Losart, which you're on everything. Your heart is fine. And you have rheumatoid arthritis, and sometimes with rheumatoid arthritis, there's arterial atherosclerosis changes just because of RA. He goes, so you may have think that I didn't do anything, but what I did was the research to look up the numbers, and there was no reason to put you on anything. So now I get to love him again, even though I was mad at him for a second. I just love him. So he says, you're going to get an MRI. I'm going to see you in 3 weeks, and, stop trying to poop. It'll happen naturally. So here we are. It's just a shit show. Healthcare in America, no matter how good your insurance is, requires you as a patient to be your own advocate. If it sounds wrong, it's probably fucking wrong. No one knows. People walk around and ignore symptoms and stuff. The symptoms are still there. You know they're there. You're just choosing to ignore them. Nobody walks in the hospital and they go, oh my God, your bone's broken. You fucking knew it was broken. You just been limping along on it. Do you know what I mean? You still have to advocate. You have to advocate for your own care. You have to advocate for the type of care that you want, what you demand, what you need. And a person like me who maybe can tolerate things a little bit better, who's lived with chronic pain her whole life. So maybe if I go into the ER and they say, what's your pain level? And I say it's an 8 on a scale of 1 to 10, like my sisters say, it's probably a 12 or 14. It's real pain. But see, I fuck myself and say, no, I must not be in pain because these people aren't even concerned about me. But that's the apathy of ER medicine, which is kind of dovetails into the apathy of cops. If you see pain seekers all the time, people just trying to get pain pills, and you see people that come to the ER because they need attention, like literally there were 4 patients in the ER. 2 of them were drunk and 1 was a diabetic. Literally 2 drunks and a diabetic and me. It's not like it was filled with people in the ER. Like, where are the COVID patients? But the helicopter landed twice. I don't know what that means. Maybe those people had COVID and they rushed them straight into the ICU or something. They weren't triaging them in the ER, which ER triage but can be a shit show. It's like when I was in the hospital with a stroke and it was septic pneumonia, and the one doctor came in and said, oh, you have a kidney infection. Really? I do? You don't think I would have fucking known if I had a kidney infection? He goes, but this this urine test is from the ER, so, they probably threw the urine on the ground, scooped it up, put it in a thing, and then tested it. I said, I don't have a kidney infection. What the fuck? Just like I didn't have pneumonia, but apparently I had ground glass syndrome in my lungs, which was, you know what I mean? Whatever. And then Dr. Madelon listened to my lungs. He goes, your lungs don't sound good. There's something in there. And then I cough, one of my big fucking husky coughs. And you listen again, he goes, it sounds better now though, so you just need to clear that mucus. So I produce mucus at a high level. That's my diagnosis. Where's the pulmonologist for that one? It's like, your blood hypercoagulates, and that's why the stroke just encapsulated quickly and I don't have much damage from that. I have hypercoagulating blood and I also have hyper mucus production. What's with the hyperness? I'm not hyper, I'm calm as motherfuck. So anyways, I hate everyone except Dr. Madelon and Dr. Eichbaum and Dr. Dar. And I'm going to put my hate into action. I think that there's a real opportunity here for advocacy. I think there's a real opportunity to create patient advocates, and that people need patient advocates, but you need to know the history. Like, I should never go into the ER and they should go, this is just another one of those fuckers that come in here looking for something. Because had Dr. Laird not made the comment about I only have 3 hours, you're not going to take it all up, I might have given a more complete overview. Instead I said, had a stroke, have high blood pressure, have rheumatoid arthritis, have 2 compression fractures. Like, I didn't talk to him much about me because you're a dick and I don't like you and you're being an asshole. Do you know what I mean? Like, my history has not gone on a straight path. It's not beginning, middle, end. It's a lot of twists and turns because what you see isn't always what you get. And like medicine should be interpretative. I'm not kidding you. I'm 10 minutes away from taking the MCAT and going to medical school. I feel like I could pass the fucker. I'm so stressed. Okay, so then let's talk about another little thing that occurred. I got a Band-Aid on my arm. Thomas, who could tell that I wasn't feeling well, was laying on me yesterday. And he went to get down and his nail caught in my arm and I was like, ooh. And I looked down, it looked just like a scratch, so I didn't think anything of it. And I guess I kind of